This video presentation provides training in sit-to-stand test. Sit-to-stand measures the number of time patients can stand up from a seated position and sit back down in a chair within 30 seconds. In this test, patient can use armrest or walking devices only if needed. We advise to complete this test twice with 2 minutes of rest in between the two tests. Also, coordinator can do a practice session with the patient to explain the test to the patient. I have with me Nicole, who is our model patient. You will need a chair without armrest and without wheels for this test. Also, you will need a timer for the test, or you can use the timer on your smartphone. First, place a chair against the wall. Then, ask the patient to sit in the middle of the chair comfortably. Also, patient's feet should be flat on the floor and back straight. If patient is able to rise from a chair without assistance of armrest, then ask the patient to fold arm across the chest. However, if patient need to use armrest to stand up, they are allowed to do so. To start the test, give clear instruction to the patient. Nicole, when I say go, you will need to stand up to a full standing position, then sit back down, and you will continue to repeat these movements for 30 seconds until I say to stop. Set the timer at 30 seconds. Then start the timer and say go to the patient. Count the number of full repetition patient is performing. Ask the patient to stop the test when timer goes off in 30 seconds. Now we will demonstrate it on Nicole. Nicole, when I say go, please start the test. Go. Stop. After the test, record the number of full repetitions patient performed. Also, if the patient used any armrest or any other devices during the test. Note that the full repetition is full standing from a sitting position and sitting back down in a chair. If patient has not returned to full seated position when the 30 seconds are over, then do not record the final repetition. Note that you have to perform this test twice. Give patients 2 minutes of rest in between the two tests. If the coordinator or the patient does not feel the test was performed to the best of their ability, then they can discard the test and repeat the test. This concludes the sit-to-stand test training.